Good morning, everyone. So nice to see you all today. Thank you for joining us for yet another segment of Brain Health for All. On popular demand and request, we thought we would touch upon current status of COVID-19 and brain involvement. You may agree with me that most of us appear to behave as if COVID-19 has left us and there is nothing to worry about. The idea of this segment is to not to generate scary view in your mind, but to give you an update on what is really happening at this point of time. COVID-19 is pretty active in the community, and the mortality from COVID-19, specifically in the hospital setting, is pretty high. In fact, it is the second highest cause of death in Australia at this point of time. How can we avoid this? So the first thing is being aware of this and avoiding COVID-19 infection in the first place. Best way to avoid COVID-19 infection is wearing a proper mask. In particular, if it is an N95 mask, if two people are wearing N95 masks, then chance of one spreading the virus to the other is significantly less. Surgical masks are not as effective as N95 masks, but surgical masks are better than not wearing masks at all. In particular, the mortality from community-acquired COVID-19 infection is 0.3 per thousand, not that high. Whereas in hospitals, this is very high. Your chance of death is significantly high if you acquire COVID-19 in hospitals. Therefore, be very cautious when you visit hospitals and when you deal with hospital staff like myself. We as healthcare workers, we try our best to behave well and wear fit-tested mask so that we will not become the carriers of COVID-19 between people and to you. One word about vaccination. Vaccination is the other powerful weapon that we have against COVID-19. I would strongly encourage you to keep yourself vaccinated in an up-to-date way and get the double protection with the flu vaccine also, in particular during this season. If you developed COVID-19 symptoms and if you get a diagnosis acutely, make sure that you get required antiviral therapy. This reduces your chance of death and this reduces your risk of developing what is known as post-COVID-19 neurological syndrome, also known as long COVID. We talked about this in depth before. We will come back and give you an update on this in a couple of months' time also, as this is one of our key research interests. To summarize, COVID-19 is pretty active. It's there in the community. Avoid where you can avoid crowd. Wear a mask. Use all the knowledge that you gain during the first few years of the pandemic. Get double vaccinated. Avoid first infection. If you had one infection, avoid the second infection. If you had two infections, avoid the third infection. Remember, prevention is always better than cure, and it is very relevant with COVID-19 also. This virus is not like any virus that you had seen before, and avoid where it is possible. And remember the old saying, prevention is better than cure. Stay well, stay safe, take care. Thank you for watching.